how sustainable is following any diet. I don't believe in that. I believe in teaching you guys how to choose your own menu. That's one unique way about how I approach this. If I can give you guys the ability to lose weight without giving you a menu, holy crap, how much more powerful is that for the rest of your life?
It was just, what kind of carbs would you like us to consume? Like high fiber carbs, like fiber dense carbs?
Have you been trying really hard and trying to not eat, or it's just been doing its own thing and you've been maintaining?
So it's not hard, actually. It's a lot easier. So sometimes I do have a scoop of ice cream on a small cone, and that's my treat. I don't go crazy when I do eat things now, and I prioritize protein when I'm not like fasting until noon. I prioritize protein first thing in the morning, like at least getting 30 grams, and eating a lot of fiber when I am eating like sugar or carbohydrate foods, like having it be really full of fiber. Yeah.
Right.
But I'm just like focused on different things now when I'm eating.
This is so important. I hope you guys are listening to this, because this is what and you may not realize why I'm making such a big deal about this, but ability to maintain weight with ease. So look, Caitlin's not saying, yeah, I eat whatever I want, I do whatever I want. No, that's not what we're saying. That's never a future that I'm going to be able to produce for anybody, but a future where you're able to implement some of the strategies that you learned, but with the strategies, you're able to just do your thing and your body maintains. It's not like you're fighting this like body that's trying to regain. You're always hungry. You barely eat and you're gaining all this weight. That's a body that's working against you. And we call that a weight set point. And that weight set point, when it's high, that's the disease. That's the roadblock. And food chatter is one of the way that body trying to gain the weight back, that's what happens. That's what it's trying to do. It's making you really hungry. It's slowing your metabolism. It's working against you. So just the way you describe that is nice for everyone else to see, like, all right, that's what I want to go to. Because had you said something differently, oh, it's a struggle, I'm always hungry, it seems like I barely eat and I gain weight really fast and I'm having to try really hard to, like, that would, then you haven't arrived yet. So now that I know that, I would say you're probably good to not have to be so concerned about pushing the envelope necessarily to long fasting. I still think it's always good to try to get there. But now that I know where you're at now, I think for your body, for where you're at, current stress levels, you're able to probably continue on with another round and be able to pick up weight loss. The only question I would say for a starting point would be, do you happen to know how many calories you think you average a day lately?
No more than 2,000.
Okay.
But yeah, but I don't exercise like heavily either. When I do, I'm walking and I do very light weightlifting with my son. We watch videos and do it together so that
I think if you're eating 1,800 to 2,000, you're in a perfect position to start the protocol again. But I'm going to say have you ever done these meds before, Maria? I don't see that you have.
No, I haven't.
Okay. Have you been on any attempt over the past 2 to 6 weeks, like where you've been eating less and exercising more and trying to diet, or not really?
Not really.
Okay. Do you happen to know how many calories you average, or no clue?
Yeah, no clue.
Okay.
I mean, I have days that I eat a lot. I have days that I don't. So no.
Have you ever counted calories consciously, or you've never really done that?
Yes, I have.
Okay. You haven't done it recently. Based off of your knowledge of counting calories in the past, if you had to estimate, what do you think you average?
Probably like 2,500 or more.
Yeah, no, for sure. No, that's good. So the main thing with that information is you're definitely not in a reset need. You're not in a metabolic. That's actually a good amount of calories. So even if you overestimated that, you're good. So I think you're great to start the protocol as is as well. And we don't need to do a reset with you. There's always at least 1 or 2 people that need to do a reset, sometimes more.
I started keto carnivore when I actually accidentally went in the hospital about 1.5 years ago they didn't know what it was. And when I went to the doctors, my blood glucose was 535. So they sent me to the hospital in the ER. And then I learned I learned in the hospital about it. And what I learned there and what they left me with was insulin. And so when I got out, I had no direction. And so I had to do my own research. And I'm like, oh, well, I did my own research and found out that, I could kill myself with these injections. Oh, this is great. And then I did more, and then you can't get a doctor at that point. There were just no openings. So I'm like, that's a lot of learning really fast. So I did it because obviously I had to get myself down. Like I knew I'm a good numbers person, so I did the numbers. But while I was doing more research on it, I thought, this is ridiculous. So I'm obviously, now I know, way insulin resistant. I'm like over the top insulin resistant.
If your sugar was that high, then yeah.
Oh, I'm like, yeah. And did I meet it? Yeah, I was trying to do, I actually started doing what I was going to do what do you call it? A whole food plant-based diet. So I was like fruit and vegetables, and the fruit just, whew, and I didn't know it at the time. So anyway, short version is I started looking at the insulin going, wait a minute. So I'm insulin resistant, which means my cells don't want the insulin. They're telling my body to back off. I don't want any more glucose. And yet I'm going to put more insulin in my body to try to shove the glucose in the cells when the cells don't want to anyway. What the hell am I doing? And
the healthcare system.
And that didn't take me more than a month or so and this is what you're telling me in the hospital. This is the doctor that came in and taught me this. And I was like, okay, this is ridiculous. So I went on keto. I said, I'm off. I couldn't see any logic to that at all. I'm type 1, I see, but so then I said, okay, let's research this. And I went on the keto, and that was good. And I watched numbers, and I got off it, and I did all that. And it wasn't a weight loss thing at the time. So then fast forward. And so now I'm trying to do the keto, but I feel like and I don't know if this is the right way to say it, but I feel like I gained this weight because I ended up 6 years ago with a pulmonary and vital embolism. And I couldn't walk because they were trying to do surgery on my leg, but they wouldn't do surgery because I had embolism. So it was a year and a half of not being able to walk and pain before I could. And so in that time period, I learned how to fast. So I did a lot of research on Dr. Jason Young, and just, I love fasting. So that's the opposite of what Kaylin said. I love it. I go on a fast. And that got my embolism gone in 9 months, and they figured it would be a year and a half. And so I say all that to go, okay, so I started to look at the fasting with trying to do fasting, because now here I am, couldn't walk for a year and a half, surgery. And then, so here I am now at 150, I think 150 pounds overweight. And so I started to go, why? So I'm at this 350 range, or 320, 340, whatever I'm in. And I feel like my fat cells are going, you know what, this is it. This is your fat threshold. This is as many fat cells as you have. There's not going to be any more. They're not going to get any bigger. So if you keep feeding glucose, carbs, whatever, it's just going to stay in your blood sugar, your blood, and your glucose is just going to skyrocket. Because I have a glucose monitor now, and I've been watching it for the past, almost 6 months daily, trying to figure out why. And of course, I have really bad sleep apnea. So at night, my blood sugars could be low during the day if I really do well. And then they just skyrocket 150 points during the night. I'm not talking about I'm not talking about the morning thing. What's that called? It's not just the dawn phenomenon. It's not just, it's literally, they go like this. And I'm like, that's cortisol. That's my body trying to fight to breathe. That sucks. Now I got to figure that out, because I don't know which is causing which. It's like an onion, and I don't know which peel to do first. So anyway, so then I did a natural health, and I got all these blood tests. I'm like, where am I starting? And so I did that. I got all the blood tests. And then I thought, okay, I've got all these great blood tests. I'm going to do a 10-day fast, because I want to see what my blood tests are after 10 days of fasting. Because, hey, what the heck? I have a baseline. Let's see what happens. So I did that. And then that doctor is the one that said, let's try Mounjaro. So she's the same as you, holistic in the approach, medical background.
That's great.
Trying to really help people. But hey, let's see if this medication can help, because I can't eat, and I'm low carb keto, and I'm talking healthy keto, not dirty keto. And just busting my butt on trying. For me, the hard work is not fasting. That's so easy for me. The hard work for me is what am I supposed to be eating? I can't deal with this glucose. It's in the 2s and 3s. I'm like, I'm eating no carbs.
You said you have sleep apnea. Did you get into CPAP yet?
Yeah, I got the CPAP, but unfortunately, the only problem I've had before the embolism my whole life is severe migraines. So the CPAP is just blowing on my brain, and I'm in migraine. I can't get out of migraine. So my neurologist is, we'll try this thing over the summer where we'll put you on some seizure meds, which will help with the path in your brain, and maybe you can, so we got to retry that. So I have an appointment next week because I've got to get sleep. I'm not getting any sleep. And I know that's a problem, but I just
Let's do this because this is definitely more complex case.
What was the good carb macro? Are you looking 20, 60, 80?
30 to 50 is what I'd like, which is low. 30 to 50 net carbs is definitely low. It's certainly not the most hardcore. A pure carnivore diet would be like the most hardcore, but I think if you do 30 to 50 and you're doing the fasting, that's good for most people.
Just to avoid red meats, just out of curiosity.
No, I'm okay with red meat. I think red meat is phenomenal for you. Produce, if your budget allows for it, investing in more expensive, high quality meat is obviously ideal. I don't preach it like you have to do it, because then that puts a financial strain on some people. And so the reality is some people don't eat any organic and they're fine. Some people, it derails their health, right? So it's one of those things where I'd recommend, if you can budget for that, to do it. But if you can't, work within what's financially a reality for you. When it comes to produce, there is something called the dirty dozen. So those are the particular types of fruits and vegetables that you should go organic. But if anybody has any questions about that, feel free to ask. But in general, yeah, work within your budget, try to go organic, free range, grass finished, things like that. When you're not fasting, and this is so much easier concept, right? Everything I'm going to tell you is not something you never heard before, right? Eating less processed foods is the most important rule to follow in this game. So many programs out there have all these special diets, and it's just, at the end of the day, it's not that they're bad. Some of them are great, but how sustainable is following any diet? I don't believe in that. I believe in teaching you guys how to choose your own menu. That's one unique way about how I approach this. If I can give you guys the ability to lose weight without giving you a menu, holy crap, how much more powerful is that for the rest of your life? Because now you have confidence in yourself to make the right choices. You've ran that experiment and it's worked for you. To me, that's more valuable than any crazy menu I can come up with. There are obviously, again, individuals in my program that we will need to customize. For example, if you have celiac disease, if you have an autoimmune disease, okay, maybe we do got to get more strict with you, and we'll cross that bridge if we need to. But until then, we're going to assume your body is smooth sailing. So follow an anti-processed food diet. Paleo and Mediterranean are my favorite examples of that. There's plenty of other foods that are anti-processed. The only modification is we're going to go keto with this, right? We're going to go as low carb as we can. I don't worry. I'm not stressed about you blowing ketones on a meter. This isn't hardcore ketogenic diet because you're going to be fasting for so much. But I do want you to go as low carb as you comfortably can for about a couple months. Usually, because in the Warrior program, every 2 months, we get on another private Zoom like this. And so that'll be a reminder for you, but we also have reminders that go out. Hey, if things are going great, let's start reintroducing carbs to your diet. So we'll cross that bridge when we get there. But the goal is to get you eating carbs in a more of a normal amount, which is a lot more than keto and low, and then showing us and seeing that your body is still capable of losing weight. That's awesome because that's much more sustainable. The 90-10 rule is what I recommend adhering to. I don't want anybody going 100% hardcore clean because, again, that's unsustainable as well. I want you to treat yourself. I want you to reward yourself. Just keeps it clean, keeps it more sustainable, less likely to binge. Alcohol, there's no room for alcohol. It's not good for your body. Like, there's no argument for its place. But if you feel like it's something you need, keep it in that 10% category. You're trying to fix your body, so do your best to reduce that as much as possible.
For example, if I wanted to start fasting on Tuesdays, would you recommend that I do the injection on Monday or Sunday?
Either one would work. Just be consistent with it. Yeah.
Perfect.
Because on the beforehand, you're a little bit more flexible than you are afterwards.
Okay.
Cool. Okay. So the big one, the big topic now to talk about is weight loss plateaus, because I probably, the more and more time that passes in the last 2 years, the more and more people come to me already on these meds. And so a lot of them come in with metabolisms already freaking messed up, and we got to fix all that. I got my list of each of you. So we're going to start with Caitlin. You've already been with us for 2 months, or you were with someone else for 2 months?
No, I was with you all for 2 months.
Fantastic.
Yeah. Let's see. So I started, I think it was at the end of January, and then I moved, and I was doing it throughout the move and ended, I think, March. Like maybe mid-March or something. So yeah, it worked phenomenally. The fasting is really difficult for me personally because I do have 2 young kids.
Okay.
I work full time with one of them at home, and it's just actually really difficult. Like I get so hangry, and I'm awful. So I find myself like making myself eat on some days because I'm like, okay, this is like I'm not being kind because my body's starving. Like
Right.
yeah, it sucks. But anyway, so I lost 25 pounds, which is great, but I just hit a plateau and I'm getting married. So I was like, I really want to lose like an additional 15 to 20. That is my ideal. I would be like above what my doctor would recommend for me at my height because I'm 5'3" with a petite stature. So it's definitely like a healthy range that I'm looking at. I just want to get over that like little hump. And I do think I have PCOS, so I'm going to see a doctor soon. So insulin resistance is tied with that heavily.
Okay.
Yeah, the tirzepatide really helps, but fasting is difficult for 48 hours. I can do it for a day easily. I have done it for 2, but it's just hard to do it every week. I'm finding, especially with work.
Yes. Is it more of like you physically feel like it's an impossibility for your body, or is it more mentally you just don't want to do it? And just I just want to see what path we're going here.
Yeah, so it's more like physically for my body because
Yeah.
I get really hangry, like grumpy. I'm awful to be around, and
Totally.
that's not good for my job. But then also like I get like foggy. Of course, once I get past that 1 day hump, it's not as bad. I like feel clear, but it's that day, and I can't figure out like how to get
Well,
through
and
that
that
day.
and totally. And so this is everyone else is going to learn so much too by just listening to your advanced status right now. So we first have to make sure where you're mentally at, right? If you're willing to work with me and say, okay, even though I'm running into this issue that seems tough, I would like to get there. And so what do you recommend? That's, or you're saying, I don't want to do it, then then we have to put differently. And before you answer that, look, human bodies are not this black and white. I just want to be clear. That's not what I think. If you ever ask yourself, why is it 48 for everybody? No, it's not. It's just what I've seen consistently over so many years of doing this, even before the meds, is that we need some amount of an aggressive weekly fast to really turn on the magic bean, becoming very insulin sensitive, which is the same thing as saying healing insulin resistance, making big improvements in your inflammation, and becoming very metabolically flexible. That's among many of the small goals. And all of those small goals add up to the long-term goal,